Good afternoon, everybody. My name is Mohammed Hashim, and I'm a senior organizer for the Toronto York Regional Labour Council. And welcome to Voices from the Frontline. This program is produced through a partnership between the Toronto York Regional Labour Council and the Broadband Institute. The Labour Council has been in existence for 149 years and represents workers from all sectors of the economy. And the Broadband Institute is a longtime partner and supporter of the labour movement. We're living in an unprecedented time where all our routines have been disrupted, and it's hard to make sense of what is happening around us. We have heard from politicians and health officials on what to do and what not to do. We have taken their advice and tried our best to be safe, not only for ourselves, but to protect others. However, as the pandemic advances, we are starting to see the impact of the decisions that policymakers have made. Some of them have been good, some of them have not. We've seen dramatically different approaches in different cities, provinces, and even countries. So in order to figure out how to make sense of the impact of these decisions, we decided to start this series called Voices from the Frontline. Because as the Labour Council and the Broadband Institute as a partner of the labour movement, we know that the perspectives of those most directly dealing with it all are some of the most important. So we're bringing them right to your home to have an honest and frank conversation about what they're doing, how they're handling it, and how we need to do things to make it better. This series will have 4 parts, and we will air this webinar each week on Wednesday at 2 p.m. for the next 4 weeks. We have 4 episodes lined up for you, all on different sectors. The first one today is on healthcare. The next one is on the service sector, where we'll talk about people in the food, we'll talk to people in the food supply chain and how they're dealing with things. Then it's going to be about the public sector and how the public sector has responded to this pandemic. And finally, the impact on the social services sector. In each episode, we'll have about 2 or 3 workers, as well as their union reps, to hear each of their perspectives. So for those of you joining us by Zoom, there are a few housekeeping items that we will explain how this webinar will work. You will remain muted with video off to ensure we get the best picture and sound quality from our panelists. You will have the best view of the speakers by toggling to speaker view instead of gallery view by using the buttons at the top left of your window. We encourage you to participate with text. There are 2 ways to do so. By writing in questions to the panelists using the Q&A function found at the bottom of your screen. You can also use this if you are having trouble with the platform, and one of our folks, maybe Skylar or Mike, can assist you on that. And by using the chat function, also at the bottom of your screen, to send messages to all participants or to all panelists. At any time, you can share comments in the chat, and we encourage audience discussion throughout the session, of course, respecting each other's across our differences. Please note that we won't be responding to raised hands, only to questions submitted to the Q&A. Questions will be read aloud by myself. So we have some incredible people to introduce to you. The first person we have is Joy Borras. Joy is a long-term care nurse and a member of SEIU Local 1, which is SEIU Healthcare. And later, we will have Nursing Division President Jackie Walker, also from SEIU. The second person we have is Charlotte Clarke, a paramedic and a member of QP Local 416, as well as Mike Merriman, the Paramedical Services Unit Chair for QP Local 416. And then Jen Rajkumar, a respiratory therapist and a member of OPSEU Local 575, as well as Kingsley Kwok, president of OPSEU Local 575, as well as an executive committee member of the Labour Council. So we're going to start with Joy. Let's see if we can bring her on board. Hi, Joy.
Hear me?
Yeah, I can hear you.
Okay, good.
Thank you for joining us.
Thank you so much for inviting me. I'm really proud, and I'm really proud to be part of your team today.
Joy, we thank you so much. You're working in a really difficult environment today, and right now you're at work as well, and you're working at a long-term care home. So I see your cap. It's because are you working with COVID patients today?
Yes, I'm currently working in the transitional unit with lots of COVID patients right now, residents. Yeah.
Yeah. Tell us about your workday. How are you dealing with this personally?
Like it's really hard because from the start, like the government and the employer, they know already that mostly like elderly people has underlying issue from the start, right? The health issues, but they supposed to prepare how to be like the safety of the residents and the staff in all long-term care facility. But from the start, when we have the COVID patient, I think we have started too. They're not protecting us. Like they're giving us mask, surgical mask only for those you are going to enter with the COVID room. But other than that, you're not wearing anything inside the facility. So like because they're following the government direction, like every day there are order, like every day they're changing the direction on how to do the PPE, on how to use the PPE. So it's really hard for the staff because they don't know what's going on, the actual situation in the long-term care, especially when you have so many COVID in your unit. Like we're struggling until now, we don't have N95 that fitted for us. That we're like relying to the donation of the N95 that they're giving us. We have the facial, we have the gown, and then we're using the N95 donated by like government or some uh what do you call it, like yeah,
Nonprofit
it's donated
organization.
to, yeah, profit, yeah, but we don't have really the access to the proper N95 that is fitted to all the staff in the long-term care. So everyone is scared to go inside because right now we also had a amount of staff that is already COVID. So every day, like they're changing the hours. We're struggling the staff because like right now they're doing it 12 hours right now because we're shorted staff because when the government said like it's mandatory to choose one place only to work, and they know from the start, they know already like mostly of the healthcare frontline workers have multiple jobs, including myself. I've been working full time in the long term care and I've been part time in the hospital. So why the healthcare frontliner will suffer under pressure like emotional, physical, and then right now financially like stress for everyone, especially those who had multiple jobs just to like for our basic needs.
Yeah, I mean, that's when we heard the decision that the government's going to choose between, is asking employees to choose between one facility or the other. You know, how does that impact you and your members? I know you had to choose one versus the other, but what was
For
the
me,
basis of
like
that choice?
yeah, for me, they're talking about safety. But when the government from the start, they know that COVID is gonna be like really, really like it's it's gonna hit the long-term care, and the government and the employer knows from the start that mostly of us have a multiple job. If from the start they're giving us PPE, like even we're working like 2 jobs, 3 jobs, they're not gonna be like there is no contamination like for every like because we know how to use the PPE, how to remove the PPE, how like what I'm saying, like we don't need to choose one place in the first place if they give us proper protection. But
Yeah,
for now, because like it says, you need to choose for the safety of the residents and also for the staff. Like we have staff in one job and like we're begging, it's still begging, like we're shorted, we're short of the staff every day. Like
yeah.
I'm every day. I saw how we struggled from the start, right? Like if you're short, we have how many COVIDs in the room, and then if we're short, like and we're staying 12 hours, and mostly of the staff is doing overtime because there is no one will come, like because we don't have much staff right now.
Yeah, when I heard when the government introduced that law of not being able to work in two different places, I felt, are they blaming nurses for spreading it?
And that is
Because
really sad to hear about it. That they said like we are the one giving the virus inside the facility.
Yeah.
And I think that is totally wrong. And
Yeah.
the government need to see that is totally wrong to that we feel like I'm
Yeah,
sorry.
when I heard that, I thought, I mean, like, how could they possibly be blaming nurses for spreading it? And knowing the fact that, I know that like PPE has been a major issue, and that like, there's been a nurse a long-term care nurse who passed away from COVID-19, and that's directly related to the lack of PPE. I know SEIU has they got a campaign to talk about ensuring that workers have proper PPE, but how could the government not provide PPE, but then put the onus of like of not spreading the virus and blaming them on nurses?
Because until now, like we're still struggling. We don't have PPE. Like we don't have the specifically for an N95 until now. Like we know that they have stock and they're not releasing it because I don't know when they're gonna release it. Probably after the COVID is done. That's what the staff is asking to the employer. And when are you going to release the N95? When the COVID is done and
Yeah.
it's completed, like absolutely like. So I think they're like waiting for us to all the healthcare frontliners to become COVID positive.
Yeah. Well, Joy, I'm gonna change the conversation a little bit and just ask you how you're personally dealing with it. I know I feel your emotion around how difficult it is. How are you dealing with it? How is your family dealing with it?
It's so hard because I'm isolating myself. I'm in the hotel right now, and then like when you're there, like working hard, and you go home by yourself, and you just talk to your fam in the chat time, and it's really like physically and emotionally stress for me.
Yeah, I'm sorry to hear that. How long have you been staying at home in a hotel now?
Tomorrow, 2 weeks.
Tomorrow will be 2 weeks. Wow.
Yeah.
And how's your family? How like, do you have any kids? Do you have
I
what
have
is?
4 kids. They're all grown up, so I'm happy for that. But still, I know that they still need their mom. So, like, the Filipino culture that is really close to each other. Like, yeah,
Everybody needs their mom for sure.
I really
Yeah.
miss my family. So, what can you? I don't want to spread I want to make them safe. That's why I choose to be alone, like, dealing with this pandemic.
Yeah, it's a really difficult decision to be able to. I mean, you have a job to do, but you also have a family to take care of, and having to choose between what to do and how to do it is, I'm sure, and the longer it goes, the longer that decision is going to impact both yourself and your family. Um, I wanted to ask you. I mean, like, like we're hearing a lot about the long-term care facilities and how they are constantly like more than half the deaths that have happened in long-term care facilities. And what do you feel like other than PPE, like what is the main issue behind that? Why is that happening? Why is that the case?
Um, like it's so sad. Like when you see like your resident is suffering from COVID and the family is not beside them. Like it's really emotionally tortured for everyone too. Like I know we're doing the virtual, but the care, the actual care from the family because of the restriction for the you know during the pandemic. And then for now, like they're allowing visit for only dying people inside the long-term care. Yeah, so the impact is really like it's affect for all of us because it's sad. I feel really sad when I saw the staff and the family member too. Like when we call the family and they're like, I know they are really supportive to us right now because they know that we're doing our best to take good care of their loved ones. Yeah,
How are the residents? How are they feeling?
I'm working in the behavioral unit and mostly they are demented. So
Yeah,
yeah,
yeah. I
because
know for many
all
families.
restricted. even the activity, they're all restricted. They're confined in their rooms because mostly of our residents is already like COVID, so they have to do isolation. Yeah, and then if they are really like because of the behavior, like especially when you are COVID, so you have to do something like, to stay in the room.
Wow. Joy, I don't know how to say thank you, but I know what you're doing is incredibly hard, and it's quite heroic, in a time
Yeah,
where,
I know. And I hope the government and the employer, they open their eyes on how to support us and how to care us, like, so we can continue to give care. Because if we don't support us, all of us are gonna be like ill. So
yeah,
who's gonna do our job?
yeah,
We're only asking for N95 to protect us. But why it's really hard for them to listen to us?
yeah, no, I agree with you there. Now, Joy, I'm gonna have to wrap this up, but I really wanted to thank you for everything that you're doing, and it's incredibly emotionally difficult. I mean, it's a lot that you're carrying for all of us, and I just want to say thank you for that. But if there's one thing that you would like to leave a message for everybody, what would you like us to know?
Continue to fight all the nurses, RN and RPNs, including the PSW, housekeeping, dietary. We need to be one to fight for our rights to wear the proper PPE, including the N95 respirator mask to save life.
Yeah. Thank you so much. I really, 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 really appreciate it, and you making the time. I know you have to get back to work, but thank you so much for joining us, and all the best of luck, sister. We're with you, right by you, and we have you in our thoughts and our prayers as well. Thank you so much.
Thank you so much, Mohammed. Thank you.
Okay, Charlotte, are you there? I can see you. Can I hear you?
Can you hear me?
I can hear you now. Yes.
Perfect.
Thank you.
Thanks for having me.
Thank you for coming. Yeah, that was a really powerful conversation from Joy, and really, we're hearing so much about the sacrifices people are making and the difficulties that many of the frontline workers are facing. And I know being a paramedic is a really, really hard job. There's a ton of stress that's involved. PTSD is quite prevalent in your field. So my first question is, during this time, like, why and how do you do this work?
Well, I mean, emergency services is something that I had pretty much been interested in my entire life. My mom is an emergency nurse, and I remember when she was working in the front lines when SARS was here in Toronto. So I kind of have a little bit of experience secondhand with, kind of what's going on right now. But, I do for others that I would expect that they would do for me. So, I know that if I was ever in a situation where I needed help right away, that there would be somebody there for me, is the same way that I would be there for somebody else. When people call 911, they're typically in the most vulnerable situation of their life, right? So being at home in an uncontrolled environment when you're having a medical episode, it can be the scariest experience of your life. So if I can, attend to somebody and hopefully make them feel a little bit better, then I did what I needed to do. I did my job, right? So that's kind of why I do what I do. I love being a paramedic. It's very rewarding. So yeah, that's why I keep doing it.
Being a paramedic is obviously an incredibly noble profession, but doing it during a pandemic is a bit something else. How has COVID-19 changed your work?
It's changed our work quite drastically, actually, in pretty much every sense. You know, on a regular day, you show up at your station, you check your truck, and you wait for the calls to come in. But now, you know, we have to be mindful about everything that we do. Is, you know, everything from touching the door handle when we're opening the door to go into the station. You know, we're doing self-screening every single shift now. So we have to check our own temperatures, and we have to answer a series of questions regarding if we're having symptoms or not, right? So we're getting screened every single shift. And if we test, or if we're screening positive, then we're not allowed to work, right? There's increased cleaning in the stations. You know, we're all being very diligent. We have to disinfect the trucks between each crew that takes out a truck for the day. Increased hand washing, and I'm sure that a lot of people have experienced this with the hand washing, that it does a number on your skin, right? So, you know, in terms of donning and doffing our PPE, that's something that's kind of new for us as well. I mean, on an average day, we're going into a call with a set of gloves on our hands, and that's pretty much it. And now we're wearing either surgical mask on every single call, safety glasses. If we have to show up to a cardiac arrest in the field, we're wearing enhanced PPE, which includes a face shield, safety glasses, N95 mask, and gown, because we don't know why that person is down. We don't know their full background. So we have to make sure that we're taking every single measure we can to protect ourselves against those patients. You know, the acuity of the calls has certainly gone up. You know, I think that the general public is being more mindful now of the situations that they should be calling 911, which is good, but also we're finding that a lot of people are waiting till the 11th hour to be calling 911 for help, right? So we have a sick person who's been sick over a couple of days, and they're waiting and they're waiting and they're waiting because they don't want to go to the hospital, right? So by the time that they call us, they're very, very sick, right? So we have to work twice as fast and be thinking, you know, on the drop of a dime of what we're going to do with all of our patients. I mean, obviously we're taking them to the hospital, but there are a lot of other factors coming into play, such as, you know, how we're going to treat these patients as well. So that's kind of how this whole pandemic has been affecting the workplace and how we do our work.
Yeah. Has things changed for your family and for yourself?
Yeah, a little bit. I mean, so I live alone, but my mom and my sister, they're both nurses, right? So I have a really great support system in terms of, you know, who I can talk to if I'm feeling a little bit overwhelmed with work. I mean, I don't get to see them nearly as much. The visits are very few and far in between, but we're keeping in touch. We're checking in on each other more, actually, in fact, now than we were before, which is good. So, you know, I know a lot of my colleagues, they live at home with family and they have small children, and they're feeling that pressure to go out on their, like Joy was saying earlier, that she's isolating, right? She's not having much contact with any of her family, right? Which I mean, it's hard. So I feel in a way a little bit thankful that I do have my own space, because then I'm not forced to go and stay in a hotel or staying in an Airbnb, which is, you know, it's a strange place. It's not my own space. It's not as comfortable as I would like it to be, right? So I feel a little bit lucky in that way. But
Are you hearing a lot of your colleagues are doing that?
Oh yeah, I'm hearing that. I mean, online on our groups on Facebook, people are, you know, talking about staying in hotels or staying in Airbnbs together. So yeah, I'm definitely hearing some people doing that.
When you come face to face with people who are COVID-19 positive, and what's going through your mind? Like, I mean, you're putting yourself directly at risk there.
Yeah. So, my partner and myself personally, we've come into contact with 2 people who have tested positive for COVID. One of them, it was somebody who had been self-isolating at home and didn't have very much contact with the outside world, have you? And then the other patient that we had, they had acquired it in the hospital. So when you think about that, it's like, okay, no one is really safe, for lack of a better word, from becoming ill, right? So we go into these calls and we're wearing our enhanced PPE, but you know, you can be as diligent as you want, and there's still that possibility that you're gonna get sick, right? But for someone like me, like I'm relatively young and I'm in relatively good health, it wouldn't be so much as a worry of me getting sick, but I'd be more so worried about passing it on to other people who, you know, are immunocompromised or are diabetic or have other comorbidities, right? Who might not have as strong as an immune system as I am to fight off the illness. So.
Well, the only people you're really seeing these days are people who are calling you.
That's true. Yeah, that's very true.
So, I mean, that's, of course, yeah, I can't imagine it being any easier now than it ever was before, but most certainly, definitely a lot harder now than it has been before.
Mm-hmm.
And, you know, people refer to, you know, our paramedics as heroes. When you hear that, what do you think?
I don't know. It's kind of strange, really, to hear that, because I think when I say this, a lot of my colleagues will agree with me, is that we've kind of, as paramedics, we've gone unnoticed for a very long time, right? I mean, the general public, I feel like they don't have a very good understanding of what it is that we do and what kind of treatments that we can offer people. And the situations that we were going into before COVID was a thing, right? So, I mean, you take a pandemic and you're adding it into all of the everyday things that we have to experience as paramedics, that makes it, you know, definitely a lot harder. So it's nice. It's very, very nice that we're getting some recognition now. But at the end of the day, like, we got into this profession for, you know, whatever reason that, you know, A, B, or C person may have gotten into it for. You know, I didn't get into it because I wanted to be called a hero. I got into it because I just simply wanted to help people. So, and that's really what we're still doing on a daily basis. We're still helping people, you know, and it's nice that we're getting the recognition now. And I just really hope that in the future that people continue to be mindful of what it is that we do as paramedics and what we offer to the public.
Charlotte, thank you so much. And as I asked Joy as well, is there anything that you want, you know, us to know or for us to let the public know?
So this whole pandemic, it can either do 2 things. It can either bring out the worst in people, or it can bring out the best in people. And I think for the most part, it's been bringing out the best in people. And I really hope that once we can go back to our normal lives, that people continue to be the best that they can be towards other people. You know, we're in this life together. We all need to work together to, you know, get past this. And once this is over, I hope everybody can continue on kind of that trajectory, and it unifies people. So that's what I hope for. Thank you very much. Thank you.
It was a pleasure speaking to you.
Thanks, you too.
Okay, so next we have Jen Rajkumar, who will be joining us. Oh, there you are, Jen.
Oh, hi.
Cool. Hi, how are you?
Good, how are you?
Thanks
for having me.
Of course. When I read your Toronto Life article, I thought, wow, here's somebody who's literally face to face with the pandemic. You're a respiratory therapist. It So you're intubating people. That's literally face to face with somebody who's got this virus. So I wanted to ask you, I mean, like similar to Charlotte, I mean, people are calling you, the nurses, the respiratory therapists, heroes. Like, how does that make you feel?
Firstly, oh, thank you. Sorry.
Not sure what happened there.
Okay. Firstly, I am honored that people feel this way about us, but I have to say that there is no I in team. This whole effort against the fight against COVID has been a team effort, and RTs were all just a piece of the whole puzzle, a puzzle piece, if you want to say. So heroes are everybody, including all frontline staff, including the paramedics, respiratory therapists, the RPN, the nurses, the PSWs, people doing the testing, from all the way to the hospital admin, to like the stay-at-home guidelines for the people to actually stay at home, to the very people of Ontario and Canada actually staying home. It's because, you know, people are following the rules that you see our curves flattening. And because of that, they're also helping us. It's a whole kind of cycle in this. So I would say that everyone's a hero in this, and that it's amazing that we're all working together in unison to fight COVID-19.
Yeah, it's true. What does your job look like now? And how has it changed since the pandemic?
So our job, respiratory therapists, so just to give an enlightenment of what we do. So we're involved in patients' breathing. So when a patient can't breathe, we're often called in to assess whenever someone's in distress. And then we might put different oxygen therapies on patients, like different breathing tubes in their nose or different masks that may help them to breathe. And if they're struggling, we would then put a breathing tube in, and that way we can connect them to our ventilator and then manage their breathing through life support, basically. So we've been doing that before COVID-19 has happened, but now that the pandemic has occurred, things are a little bit different in terms of, I would say, the PPE and taking extra precautions when doing these types of aerosol generating procedures. So it's a lot different right now, definitely, because we have to be prepared in every step that we take when we're going in to see these types of patients. And just like, you know, when paramedics bring those patients in, we already have to be prepared that we might have to intubate these patients. So we have to take precautions beforehand when those types of patients arrive, or whether those patients arrive in the ICU from the hospital floors when they're in respiratory distress, they're already on high levels of oxygen, and we need to then support them with a breathing tube and then support them on life support. So,
have you had to intubate many people so far?
Yes, so it's a constant challenge. I do work in the ICU and in around the other hospital areas, and we are constantly seeing people come in from the floors that we have to bring into the ICU and then support their breathing on life support. I just had experience. Sorry, go ahead.
No, I was just gonna say, yeah. I mean, like when the first person came in, that must have shaken people in the hospital, and that the first person you had to intubate. What was going through your mind at the time?
Yeah, so as from that article that was written on March 15th, it was scary because, you know, we've heard about the story, we've heard about what was happening abroad, and all of a sudden that day we're like, yep, we're going to get these two patients, they're coming from the floors, they need a lot more oxygen, and so we need to bring them down to put them on life support. So they came in, and you know, we were told to put on the PPE appropriately, gloves, gown, mask, N95, the face shield, and then we wheeled them into the room, and then we had everything prepared from the tools that we use, like a glidoscope, which is kind of like a blunt blade with a video that we can put in the patient's mouth to see like the vocal cords and the windpipe and actually pass the breathing tube through. And then to get technical, we have to measure the patient and see what type of tidal volumes they need. And then we secure them on the ventilator or the life support machine. And we basically titrate and manage their whole breathing status 24/7.
So you went into go mode.
It's a go mode, yeah. So, and
you didn't have to think twice. You're just like, I know what to do, and this is what I got to do now. So I just got to go pick it up and just do it.
with COVID, I have to say that things are different. There are certain things we don't do because we don't want to spread the virus droplets. Yeah. So, for example, like we have to attach special filters on when we're applying this breathing mask over the patient, and we cannot sort of use a resuscitator device like an ambu bag. We can't bag the patient because that will spread the droplets as well. So there are sequences in place that are different compared to normal when we do have to put these patients on life support. So we were following those protocols in place along with the doctor that was there and the nurse that was involved to prevent the spread of these droplets.
Are you getting enough PPE?
For now, fortunately, yes. There's always a constant battle of enough N95s and enough yellow gowns and shields and whatnot. And we are having to reuse our N95s and shields. We're taught how to wipe them down and put them in these sort of safe bags, and similar with our N95s, because I'm sure the whole of Ontario and Canada and the rest of the world is trying to fight for getting enough PPE and N95s. So yeah, we are reusing our N95s for the day, especially during these aerosol generating procedures.
Yeah, I mean, when I read that, when somebody is being intubated and you're putting something down their throat, that's the most likely time when they'll cough, and you're right there in their face putting that down, and that's the easiest way to transmit it, and that's somebody for sure who was sick. I wanted to ask you a couple of personal questions, if you don't mind. How's your family been? How have you been with your family? What are those interactions look like now?
So personally, I know I live with my husband, so we have to take measures when I come home. I make sure my scrubs stay in the hospital and my shoes stay in the hospital. So I'm changing my shoes, I'm changing my clothes, I'm washing them separately with soap, detergent, and bleach even, then making sure I go shower and making sure I'm wiping down my door handles and everything, so I don't spread the virus to my husband. I know my coworkers who have children, they have sent their children to live with their grandparents, so they are not seeing their kids at this time. They're just communicating through WhatsApp or any video chat device. And I know some of my coworkers have also left their families. They're paying for Airbnbs and hotels because they don't want to spread the virus to their wife or kids or their parents. So they're now paying for separate living quarters. So
are they themselves paying for it, or?
Yeah, they are paying for it, which is kind of unfortunate because they're working to pay for their Airbnb basically. So it is hard. I'm not gonna lie, it is hard on everyone's different approach to this. I'm sure all frontline healthcare workers are experiencing the same, and we're all doing this to protect our loved ones, to protect our coworkers, to protect everyone from contacting the disease, because we are dealing with patients on a constant basis who are COVID positive.
Yeah. What has been the hardest thing for you?
The hardest thing has been a lot of things, from one, not being able to see my own family and not being able to see my own family and friends, and for my coworkers not being able to see their kids and their family. Also, it's hard for the patients as well, as you probably heard from Joy. Their family's not allowed to come in and see them. And so as a patient being isolated, that's probably hard for them. It's probably hard for the families as well, not being able to see their loved ones who are on life support. It's hard overall. And I'm sure the people staying at home are when can we get back to everyday life? So I commend everyone for staying at home and doing their part, because without everybody in this, we wouldn't be able to face COVID-19. Again, it's a global unity against this virus.
Has there been anything that's been inspiring to you in all this?
There have been some inspiring moments, and I have to say the most rewarding thing out of this all is seeing a patient get better. So being in the privilege of being in the ICU, I do get to see people who are actually getting better off the life support machine. We're weaning down the settings, and they're actually getting to breathe on their own. The best part is actually taking the breathing tube out and seeing them awake, alert, happy, talking to you. That's the best part. So taking that awful tube from their mouth, putting them on maybe no oxygen at all eventually, and seeing them leave the ICU, that's such an applauding moment. And yeah, we're applauding those people who have actually fought the disease.
You clap for them.
Yeah, we clap for them, and we talk about our successes. Like, yes, we have this amount of patients, but we've also had this amount of patients who have successfully fought the disease and are now off our ventilators, and that's an amazing success. And we should all be proud of that, because that's a great thing. So that's incredibly inspiring, along with the absolute incredibly great teamwork that we have from all frontline healthcare workers and people involved.
Jen, thank you so much. It's always inspiring to speak to you, and keep doing what you're doing, because we need you out there. So thank you so much. I'm going to now bring in 3 more panelists. So thank you, Jen. I'm going to take you off now.
No problem. Thank you for having me.
Thank you. And I'm going to bring Jackie Walker, who is the president for SEIU Healthcare's nursing division. I have Mike Merriman, who is the paramedical services unit chair for QP Local 416. And I have Kingsley Kwok, who is the OPSEU Local 575 president, as well as a Labor Council executive board member. So I'm hoping you are all now unmuted. Mike, I don't know if you're unmuted yet. All right, perfect. Welcome, everybody. Those were some powerful things that we heard from people. Any first reactions?
Aren't they all great to share their stories?
They're so powerful. I mean, all 3 of them were just so inspiring to hear and to talk to. So I'm gonna jump in. First, there's a lot for us to chew on there. I mean, we've heard talks around PPE. We've heard difficulties around people and their families, and so I'm gonna start with Kingsley and Jackie first, and Mike, I hope you don't mind. But I was
no problem.
There's a lot of people that are working multiple jobs in the healthcare sector. Is that a normal for the industry?
Yeah, Mohammed, it's definitely normal, and thank you to the Labor Council for setting this up. And I think one of my first responses is hearing from Jen about the positive of patients recovering. And as Jocelyn talked about, we represent the majority of nurses in long-term care, and although some are recovering, I'm not sure that it's the same numbers that we're seeing in hospital. But to your question, Mohammed, about working multiple jobs, definitely there is a fracture in our healthcare system in Ontario to the work that is offered to registered practical nurses in Ontario. As of last year, 2019, 56% of the registered practical nurses in Ontario work part-time. Now, that should
56%.
56%. That's more than half of the registered practical nurses who are in situations like Jocelyn and Joy, who have to go from job to job. And, precarious work is not something that I think the public or the government connects to the nursing profession. But when it comes to registered practical nurses and it comes to good jobs with good wages where you don't have to work 130 hours in a pay period, that's really the systemic.
Kingsley, what do you,
Yes,
what do you find some of the issues that are underpinning this experience?
well, there are not enough permanent full-time jobs out there. Whether it is the existing workers who are finding that they have to remain in their jobs instead of retiring, or the employers themselves trying to maximize what they can get out of workers, and so they are not posting permanent full-time jobs because the employers think that there are benefits that are tied to these jobs, so they don't want to post more jobs, and so all they do is post casual postings or part-time jobs and to get the work done. And even during this COVID pandemic situation, hospitals are posting lots of temporary full-time jobs. However, people in the industry, we know this, if we get sick, when we are not permanent full-time, we don't get sick benefits and we don't have access to any health benefits, because even if we're temporary full-time, we are like a part-time or casual, we don't get these benefits. And that's what the employers are trying to save in their bottom line.
Jackie, is that true for, it looks like we might have lost Mike for a few minutes, but is that, like, are employers also avoiding having to hire full-time people in long-term care because they don't want to pay full-time wages and benefits?
I mean, I don't think it's new, Mohammed. I think that these for-profit long-term care operators are in this work, in this line of business to profit and to make money. I mean, CEOs got bonuses last year, management got bonuses last year, and yet they didn't have a supply of PPE that would be adequate to support the workers providing frontline care to COVID positive or presumed patients. So I definitely think this is a tactic of a for-profit, and not just say for-profit, like it happens in hospitals too. We as a union and the workers demand during bargaining an increase in full-time work. But we know, like Kingsley said, employers can get away from paying benefits, from providing a pension, and really a future sick days to their employees. And I think that this COVID pandemic is really just shining a light on that. I think when Premier Ford said that they would be redeploying nurses from the hospital to long-term care, and we'll come up with a way to redeploy people. I think what they didn't look at was the numbers of actual frontline healthcare workers. We don't have enough workers who are committed, who are dedicated, who are out there every day. There is not enough human resources to answer this question by shifting people around. After COVID, and I pray it's sooner than later, our provincial government and all of these for-profit organizations really need to be called to task to create permanent full-time work that provides frontline nurses with benefits, pension, and sick time, and a decent wage. Again, nurses wouldn't be working 100 to 130 hours a pay period if they receive the type of income that would allow them to pay for their mortgages, to pay their bills, to feed their children, to pay their rent. It's
What's
just
the average salary, Jackie?
Well, it's an hourly wage, and that is definitely a problem across the province. Also, when you look at what I call, and the nursing division calls a hierarchy of healthcare and appreciation and respect for the frontline workers, where we have nurses on the front line in the hospital sector who are making much more than long-term care nurses. And so that's part of the struggle as a union is like, we need all workers to be respected, and we need a baseline to make sure that your knowledge, skill, and judgment as a nurse is appreciated no matter what sector you work in. It's really scary, some of the things that Ford and the chief medical officer have put forward as a province, and it really leads me to believe that they don't understand who is on the front lines and what the work is that they're doing in the care that they're providing is.
I'm gonna turn to Mike for a second. Mike, your members are dealing with a lot as paramedics and always have been. You know, what do you think some of the big lessons we need to think about that are coming from your members?
I lost you a little bit there, Mohammed. You'll have to run that by me again if you got me.
Yeah, I just said, like, your members are dealing with a lot, right? They're
Absolutely.
They're like, what are some of the big lessons you think that you're hearing from them and that we need to learn?
Not so much from what I'm hearing. Well, what I am hearing from my members, but it's obviously not a member-driven issue. It's an employer-driven issue, which I think everybody's expressed on this show is first of all, the shortage of PPE, the lack of preparedness, the lack of pandemic stocks in, central stores for the city, at least for Toronto. There's concern from my members out there right now. They're using 13-year-old N95 masks that were carryover basically from SARS. These masks are 13 to 15 years old. They were basically recalled from the manufacturer because they've outlived their shelf life. But nobody kept on top of this, and this is all we have to use. So making the best of not a very good situation. I think that's one lesson that hopefully the government municipalities are going to learn, that basically you never know when something like this is going to happen, and you definitely have to be prepared for it. It's quite obvious that worker safety was not at the forefront of all of our employers' concerns. I know out of the SARS Commission, those are more or less guidelines that municipalities were to follow, but they weren't regulations. And hopefully out of this comes regulations from the provincial government and or the federal government that mandates municipalities that they have to ensure that they have this stock in place. I mean, our service, Toronto Paramedic Services, actually had to purchased a mask disinfecting machine. We're not so sure of the efficacy of that, how it degrades a mask.
No.
It seems to be okay from what we're hearing. It still needs approval from Health Canada, but that's the situation they let themselves get in because nobody was on top of this. And it's not just Toronto, obviously. It's across the board from what I'm hearing. And very disturbing from what I've heard from Joy. I mean, I've seen pictures of long-term care staff wearing green garbage bags for in place of gowns. It's deplorable. It's disgusting that obviously worker safety, again, was never in the forefront of employers' minds. They've learned nothing from SARS as far as I'm concerned, and hopefully there's going to be some lessons learned this time.
So, I mean, what are the lessons that we need to think about? I mean, this pandemic has opened up a whole lot of cracks. I mean, just in terms of when we talk about the long-term care nurses, if we know that they're working in two different facilities and the government
Correct.
says, no, you get to pick one and only one. And then all of a sudden, nurses are faced with a choice. Okay, I go to this place or I go to that place. And now all of a sudden there's shortages in one place versus other places.
Exactly.
And I mean, to me, that's not being like, that's not having a preventative principle in mind. It's just saying, here, we'll pass the buck to nurses to kind of sort themselves out, but we as a government are gonna relinquish our responsibility to make sure every place is well staffed, everyone is respected, everyone has got a decent pay, everyone's got sick pay, everyone's got to be taken care of. I mean, I'm seeing different things in different jurisdictions on this one, but Jackie, you wanted to join in on that one.
Yeah, I mean, decontamination of masks, like first off, I want to say, like, as a nurse, as a healthcare provider, RT, nothing has really been proven to be safe to clean the mask, decontaminate the mask, and then apply to a worker. So the whole understanding that the government didn't learn from SARS is like, it just drives me crazy. My mom's also an RN and she worked through SARS. I was a screener through SARS, and now I'm a nurse, and I'm like, we're not prepared. The precautionary principle is, I feel, the basis of the Commissioner Archie Campbell's report, where the precautionary principle says we can't await scientific certainty to apply the most reasonable precaution for worker safety. So the fact that hospitals and the government are, you know, throwing around this idea of decontaminating PPE, no, get the PPE to the front line. We hear from the federal government, you know, 7 million respirators being shipped in. Get it to the front line. There's also measures that I think the provincial government needs to look at before they start talking about decontaminating PPE. I haven't seen from the provincial government's mouth talk about elastomeric respirators. This is a form of reusable PPE that has inserted filters that can be N95 to N100 protection for the worker. So I just want to caution everybody, before we start, you know, considering these conversations, we know we have to be good stewards of the PPE, but we have to make sure that we're not putting workers at further risk by decontaminating PPE, hanging it on a hook. One of the challenges that we're really seeing in long-term care, I think Jocelyn brought it up, is that long-term care workers weren't all mask fitted, all N95 fitted. So when Jocelyn talks about being given a respirator that doesn't fit her fit, it's no longer an N95 mask. It might as well be a surgical mask. It's not up to the same standard. So Jocelyn said, you know, around the precarious work idea, that we wouldn't, you know, you couldn't have blamed the frontline healthcare worker for spreading this because we had to pay our bills, because we had to provide for our family, because we were threatened by employers that if you don't come to this job after April 22nd, that we will call the college on you and you will be reported for abandonment of work. So employers are, you know, twisting the government's directives to the 19th degree and leaving workers at risk and leaving workers in fear. Now I have to worry about losing my license. But Jocelyn said, if they protected us from the beginning, there wouldn't have been this spread in the long-term care facilities if they would have provided workers with PPE. So right now, we are in a situation where a nurse has completed her patient care risk assessment and told the employer, I need an N95 mask because there are some aerosoling things that are going to be happening here. And they are told no to this day. And SEIU and the nursing division and our members and the public who have sent letters to the MPPs, we're going to continue to call on you because, you know, we have to really bother them. Like, if the death of Christine, PSW from Ultima, is not agitating the government and employers enough to exercise the precautionary principles, I'm fearful what is. And I understand that, you know, profits are important to them, but people are important to our healthcare system, and people are important to me. And we can't keep, you know, using nurses and frontline workers as a sacrifice, saying that, well, a surgical mask is going to protect you with a face shield. We need to do better. The government needs to do better, and these employers need to do better at considering workers' health and safety and preventing the spread.
I'm gonna open it up.
Hi, Mohammed. The gaps that we have seen now, and we're not even to the beginning of May yet. The emergency measures started at the start of March break on March 15th. What we have seen now is unions have to go to the Ontario Superior Court or directly to the Ontario Labor Relations Board to order employers to provide personal protective equipment. We are seeing that we need to really strengthen Joint Health and Safety Committee to have these committees speak up and support workers, because, like Jackie said, the employers are treating work refusals as insubordination, and so it's really reprising against workers. So these are principles that union activists are directly opposing what we are learning in our worker health and safety courses, right? So that's what employers are doing, and we now have to go to the courts to do it. We now know that Ministry of Labor inspectors have to are scrutinized by their bureaucracy before they even issue reports. We've now seen in Alberta where they do Facebook video conferences on inspections on that food processing slaughterhouse. And guess what? We now see a big outbreak in High River in Alberta. And even McDonald's now have to import beef because that slaughterhouse is shut down. We are now seeing that provinces don't do the same thing in long-term care or in healthcare. British Columbia pay better wages and took over long-term care personal support workers a lot earlier. Quebec asked the federal government for the army to intervene way earlier than Ontario. And see what Ontario has done. All Ontario has done is ask the army to help out in only five long-term care homes. As Jackie said, we need more workers, and we're still seeing Ontario lagging behind other provinces.
We've got a couple of questions from the audience, which so you touched on this, Kingsley, but let's open this up to everybody. The Ontario Labour Relations Board has received hundreds of work refusals in the last little while. And the Toronto Star article, it said that they had accepted none of them. And that the inspectors were being stifled from being able to say, yeah, this is a legitimate thing that's happening. So how are work refusals, as well as your joint health and safety committees, how are they functioning right now in order to help better protect your workers? Anyone could take that.
So that's a really good question. I think something that's happening right now, Mohammed, is when the declaration of emergency was called on March 15th, this really gave the employers the attitude and the opinion that they didn't need to work with their unions, with the members who represented on the health and safety committees. And these were parts of the reasons that SEIU and other unions went right to the Labor Board and the Ministry of Labor and the Ministry of Health to call forward their lack of action on some of the issues that were being flagged by workers through work refusals. So one of the flaws that I've identified, that we've identified as a team, is that the recommendations from public health are not the strongest. They are putting workers at risk. Their definitions of aerosoling generating procedures don't include something like a cough, where I know the whole reason for social distancing is so that if I cough, that you're 6 feet away from me and it can hit the ground. When a PSW is feeding a resident who's unable to do that on their own, and they're denied an N95 mask, everyone in the facility should be nervous. Everyone who has a home that they want to go to should be nervous about that, because it's not taking into consideration the precautionary principle and employer's responsibility to do everything possible to protect a worker. If you know that a patient in long-term care is positive for COVID, any worker who goes into that room to clean, which by the way is not happening twice a day, to clean the rooms, to provide care, to assist with any ADLs, they should be provided with N95 respirators. There shouldn't be a question, and nurses shouldn't have to beg. PSW shouldn't have to beg. And
Jackie, do you have any of your members who are sick?
So as of right now, we have reports which have been very difficult to get from the employers, which we're mostly getting from calling all of our members. Over 1,100 long-term care workers have been in quarantine due to this pandemic. And in the hundreds of members who have been tested positive. And the heartbreaking thing is that as we call all of our members in these impacted units, is the lies that the workers are being told, the nurses, the PSWs, the environmental service workers are being told about the level of protection that they should have. Now, where's the problem in this? It's in some of the public health recommendations. Are they applying the precautionary principle to protect workers and to protect the public? I do not see that in their recommendations, and it's dangerous, and it puts us all at risk. It's very.
I had no idea the numbers were so high. Mike or Kingsley, did you want to weigh in on that?
I just like to, add Jackie's right, what she said earlier, Mohammed. It had the employers, the government, municipalities, etc., prepared for this. There'd probably be no need for work refusals right now from workers. It's because they're not prepared. Substandard PPE. It boggles my mind. You hear out there a lot in society that unions are dated. Oh, you don't need unions anymore. They played their role back in the turn of the century when there was child labor and 1920s coal mines type of work. I'll tell you what COVID has shown to me is that unions are as relevant today as they ever were with the actions of the employers and the government. Obviously, worker safety is not in the forefront of their minds by any means. The CDC originally came out, Center for Disease Controls, originally had come out and said for COVID, N95 masks for healthcare workers. All of a sudden that gets watered down to, it's only when you perform an aerosol generating procedure. Now, I'm not so convinced that that's based on science as it is based on supply and demand, because there's not enough masks right now, and it could also be cost, because an N95 is a lot more money than a surgical mask. And, it's just the government and we as trade unionists have to ensure they've learned some lessons from this too. I've heard that myself. It's sort of blaming long-term care facility staff for spreading the virus around because they have to work from between maybe 2-3 LTCs. It's not their fault. They're trying to make ends meet. Part-time work has to end in healthcare. It doesn't serve the public well. These are just people that are trying to make ends meet. It's no different. We have part-time paramedics now as well. You don't see part-time firefighters. You don't see part-time police officers. Any way they can save a few pennies on the dollar at the expense of the worker that I believe the public suffers for as well.
Mohammed, how many times have we heard from whether it's corporations, the business lobby, or the right-wing politicians saying that government should be run like a business? Now we are seeing the effects of austerity, cutback, free trade, globalization, everything run amok along with this just-in-time supply chain. If we didn't have austerity and cutbacks, we would have hospital beds. We would have hired the permanent full-time workers. If we don't have free trade and globalization, we wouldn't have morons like Trump saying that we're going to close the border on a Friday so that 3M can't export N95 respirators to Canada. If we don't have just-in-time supply chains, we would have filled up our warehouses and our distribution centers with N95 respirators. So I think now we have finally started talking about the value of essential workers. The point that we really cannot run public services like a business, because when disaster hits, we are finding out that we really need to conscript soldiers to help in long-term care. That's not a business model that we can rely on, and that's not a business model that we can give our loved ones who live in long-term care. I thought we were supposed to value our elders and the older generations. Instead, we are seeing, in effect, death panels without us actually acknowledging that there are death panels in Canada.
Yeah, I mean, it's been just thinking about what the experiences of people who have trusted who've trusted home cares. I mean, like homes to be able to take care of their elderly, and to see what's happening with them now. It's really an incredible shame and quite the reflection of how poorly government has prioritized elderly care for a very long time. There's been a couple of questions. One is, if the military personnel are put into your workplace, how would you feel? Would that make it easier for everyone? Is it safe? Would they know what to do? I think that the only place that that's being applied is long-term care. So, so Jackie, do you want to quickly do that? And then there's a couple more questions I want to get to.
You know, we reached out to several of our employers who now have a reservist, we believe, on site. And when you talk to the workers, like, I mean, first off, the military refused to go in before one of the facilities, Altamont, was cleaned properly. So, I mean, to me, it's like, okay, it's what's good for the personal support worker in long-term care isn't good for the military. So I'm kind of confused still. Their level of intervention. I've seen more deployment teams from hospital where they've deployed like RNs and RPNs and respiratory therapists, people to do PPE coaching. I mean, when we did our appreciation rally at Altamont Nursing Home, drive-by, sorry, you know, we saw the military sitting in their trucks. So does that remove them from providing care? Probably. This is something that we are asking that the employers tell us, and you know, the corporate offices don't even know what's going on in these units. So it makes me really not believe that, you know, these numbers that are being sent out by the government on the amount of PPE, I don't think they know their, like, what's the saying, their head from their feet. There's a lot of confusion around that in some facilities overall, Mohammed.
We're gonna wrap this up relatively quickly, but you know, yesterday was our National Day of Mourning, where we remembered our members and those who have died due to being in their workplace. And our first fatality that we saw because of COVID-19 was Christine Magdagarian. And Jackie, I wouldn't mind if you would just tell us a little bit about her.
So what I do know, Mohammed, is shamefully, Christine was not the first healthcare worker to die from being exposed to COVID in the workplace. She was the first SEIU member, which is when we created the space to have a memorial for her. What I know about Christine is what I heard over the memorial from her family, that she was the first one to jump up at a call bell and the first one in the facility getting the work ready for all of her staff for 31 years. And she just had a huge heart to give and care. And somebody said something along the lines of, you know, these are my babies. And, you know, as a professional, we're like therapeutic nurse-client relationships, but we build relationships with workers. And I think coming out of SARS, knowing that the largest group of victims was healthcare workers, the people who perished, because occupational health and safety controls were not in place and were not seamless, that we all have a role to play to make sure that we can hold Premier Ford and his government accountable into creating some systemic changes within our healthcare system in Ontario so that it can do the job to serve our communities, and that employers and the employer and the government protect workers. The fact that Ford cut a bunch of health and safety inspectors, I think it was just last year, like that should be a red alarm bell to all of us, that where is the support for healthcare? Where are the support for workers when we have the leader of the province, you know, cutting back things that are supposed to systemically set us up to be safe? So these are some things that maybe our audience, like they're down with that message, but the public really need to know there are cuts that happened before COVID started that created an even worse environment for all of us. And yeah.
Are there any final words, Kingsley, Mike?
We really need to empower and remind ourselves that health and safety representatives and joint health and safety committees are really key in keeping things safe, to prevent accidents and injuries, and to hold employers accountable. I think we don't have to go back to the SARS Commission, although their recommendations are very good. We have this pandemic now. I think going forward, we have to train up a new generation of health and safety activists, union activists, to not only to advocate, but just be our eyes and ears in the workplace, and call things out when the employer is missing in action in health and safety.
Mike?
I just wanted to point out with the workers that have been denied their work refusals, it really doesn't come as a surprise. I mean, I've never put a lot of faith into the MOL or the Ministry of Labor, because you have to remember who butters their bread, which is the government. And with the government making changes to legislation now, which, under Emergency Measures Acts that rape our collective agreements. And as Jackie pointed out, the employers just seem to love to capitalize on that. And, there's a sense of playing ice in the sand with us, because we can run to the government and strip your collective agreement if need be. As workers, though, as trade unionists, more so, and as trade unionist leaders, we have to stand up for those workers. If it's a worker refusal in paramedic services, or if it's a work refusal in long-term care facilities, we're all in this together. And we have to, no matter what union we're from, whether it be QP, OPSEU, SEIU, we all have to work together here and protect our members, because we certainly know that's, again, not the forefront in the government's eyes.
Jackie, final words.
Final words are coming from Jen, where she said there's no I in team, and there is an I in unity, right? And like to Mike's point, like this is the time for us as healthcare workers to unite, to stand shoulder to shoulder and support. If you hear that there's an appreciation rally, or that there's an outbreak in a certain facility, like whatever you can to do to show up, I encourage you to do that. You could visit SEIU Healthcare's website and take action by sending a letter to the MPPs in your community, also Ford, the Minister of Health, the Minister of Long-Term Care. We really need to rally together now and make as much noise and educate as many people as possible as to what is really happening. I'm sick of seeing Ford at 2 o'clock on CP24 looking like an angel, that he's giving PPE to everyone who requested. It's not happening, and it's really time that everybody understands this, not just the workers who are suffering in isolation and fear while they're at work and while they're in their hotels or wherever they are. We need to come together.
Thank you. There's and just some final thoughts. There's a link that's shared in the Zoom chat. There's a Workers' Health and Safety Center offering updates on worker rights and employer responsibility. So they're holding a Zoom call tomorrow at 11 a.m. So if anyone's interested in understanding more about their rights in the workplace, tune into that. The link is in the webinar, and we'll leave it on the Labor Council website as well. But I think, what this has really exposed for all of us is that this pandemic has really opened up a lot of seams where we knew there were cracks before, and those cracks are now becoming gaping holes, and we're seeing that right across the board. The fact that there haven't been full-time positions, there haven't been people have privatized healthcare to a large degree in order to make profits. Healthcare is not being delivered solely for the benefit of people. It's being delivered also to make money for corporations. And those decisions have consequences. And we've seen that like very vividly in the long-term care sector. And we're seeing it right across the board as well. So I wanted to thank you all for joining us in this webinar today. It's been really informative to us. We, as a Labor Council, are always in desperate need to really hear from people on the front line, because it's their experiences that will decide how we advocate for issues, how we push on governments, and how we collectively work as a labor movement to fight for everybody. So I want to thank you for that, and I'm going to now end the webinar. And I just wanted to say thank you for joining us. But before we do that, let's take a quick moment of silence for our sister that we lost. And then after that, we will end the meeting. Thank you, everybody. Thank you.
Thank you. Thanks, everyone.
Thank you.